Smoking increases your cardiovascular risk significantly. Smoking also increases your risk of developing type 2 diabetes. It's important to stop smoking for a number of reasons, but your risk of developing diabetes if you're not a diabetic may go down if you stop smoking.
Unfortunately, people who smoke, they have a faster disease progression and they suffer more of the consequences. So for example, things like high blood pressure, cardiovascular disease, strokes, even heart attacks, they're higher in people that smoke.
Smoking is absolutely horrible for someone who has diabetes. There have been studies in the past that have actually shown that diabetics who smoke have higher than normal A1C levels than a regular diabetic who does not smoke. What it also does is the nicotine, which is a harmful component in your cigarettes, it has the ability as well to essentially make your blood glucose control even worse.
Sometimes people have no symptoms, so you're trying to convince them that an illness that they have can potentially lead to further complications, early death. So it's sometimes a hard sell when someone's not having a symptom. If someone comes to you and they're having chest pain and you tell them they're having a heart attack, they're going to be pretty motivated to change. But if you just tell them, well, your sugar is 150, you really need to do something to reduce it and work with them, sometimes it's a little bit more difficult. The important thing about quitting smoking is that the benefit of stopping smoking begins as soon as you stop smoking and gets better and better the longer that elapses when you haven't had a cigarette. So what I tell people is that their risk of lung cancer, of lung disease, of heart disease, of stroke, all of that eventually starts to move back towards baseline the longer they've stopped smoking.
The addiction for nicotine is very real in lots of patients. Certain things that your doctors can do in order to address the smoking addiction issue. There are certain medications that are used by doctors to try to help with the smoking addiction, but first and foremost, what your doctor will do is talk to you to see if you are ready to quit. That's usually the first step. If a patient is not ready to quit smoking yet, there's really not much you can do in order to help them to break that bad habit and break that cycle. So it's really a step-by-step approach with every patient to kind of see where they are in their willingness to want to actually stop that bad habit.